Lindsay's next appointment is 15 days later on September 28th. And by this appointment, Lindsay hadn't started taking the Zoloft and hadn't seen the therapist that Dr. Tuff recommended. But according to her, she was feeling better.
So at this point, she was improving, and we decided to pause on the medication question and have her meet with one of our therapists.
So that first appointment was on September 15th. You recommended therapy. The next appointment was September 28th. So had Lindsay not scheduled a therapy appointment yet with Jennifer McAllister at that point?
I'm not sure when she called to schedule that.
Lindsay's third appointment was on October 3rd, 2022, and it was again a virtual appointment, and it was for two reasons. Number one, Lindsay wanted Dr. Tuff to fill out a form allowing her maternity leave to be extended.
Thanks again for all your help at our last two appointments. While I'm feeling just better enough to function without medication, I did reach out to my employer about extending my leave for reasons of postpartum anxiety/depression. I don't feel mentally well enough to return to taking care of patients with a baby at home that still won't take the bottle. I know this will trigger my anxiety too much, and also having to stay up all night as a nurse, I don't feel it's possible right now. They asked that my provider could fill out a form so they could process this request. Can I please send you the form to fill out? And you responded on September 30th, 2022 at 2:41 p.m. This type of paperwork often requires a lot of information, so it's best if we go through it together in an appointment. Do you recall that?
Yes.
And secondly, that period of Lindsay feeling better was over. According to her, she was back to feeling anxious.
Well, she was having more anxiety again. It seemed like maybe it had started getting better, and then it was kind of where it had been when she initially reached out. And so she was feeling like a medication might be helpful.
Lindsay's fourth appointment is on October 20th, 2022. And at this point, Lindsay had started taking that Zoloft. But after taking it for a week, she increased the dosage because that's what Dr. Tuft had originally instructed her to do. And according to Lindsay, it made her feel terrible.
She was having increased difficulty sleeping. She had loss of appetite, diarrhea. She was feeling her mood was down. She was tearful and feeling very foggy and feeling very anxious.
At this meeting with her, did you ask her if she had any suicidal thoughts?
Yes.
What was her response?
No.
Did you ask her if she had any homicidal ideation or thoughts?
Yes.
What was her response?
No.
Did you ask her if she was hearing any voices or seeing any visual hallucinations?
I'm not sure if I asked that in that appointment, but she was very clearly not psychotic.
Did she also tell you that she was worried about getting suicidal thoughts?
Yes. It was one of the things that she was anxious about. It was a fear of one day having suicidal thoughts if she were to continue to feel poorly.
All right, so then there was an appointment the following day on October 21st?
Yes.
So why did she have an appointment that following day?
Because she was feeling pretty poorly after starting the Zoloft, so we were following her closely.
What was the plan that was formulated on October 21st?
So the plan was that she start a medication called Ativan to be taken as needed, which means not necessarily every day, but in the instance of severe anxiety.
And was there also, again, a recommendation to go to Ms. McAllister for therapy?
Yes.
So that's 5 appointments over the span of 1 month, and Lindsay really hadn't started to see much progress. She wasn't reporting that she was feeling suicidal or homicidal, but she did express fears of becoming suicidal. Dr. Tuff told her to try out the newest prescription and come back in a week to update her on how she was doing. And when Lindsay came back, there still wasn't much improvement.
What was her mood, according to her?
It was anxious and depressed.
And did you discuss with her whether she was taking the Ativan and whether it was working?
She said that it was not helpful for her sleep, but it made her feel less anxious.
Did you ask her that day if she had any suicidal or homicidal ideation?
Yes.
And what was the response?
No.
Did you see any signs of psychosis that day?
No.
And what was the plan after meeting with Ms. Clancy on the 26th?
So we discussed starting the medication Buspar at 5 milligrams twice a day. It lowers anxiety.
Now, throughout this process, Lindsay continuously expresses that she is hesitant about starting new medications because of the risk of becoming addicted to them. So even though Dr. Tuff prescribed the Buspar, at Lindsay's next appointment, she tells Dr. Tuff that she never started it.
So she did not start it. She was too afraid to start a new medication.
And did you ask her if she had any suicidal or homicidal ideation?
Yes.
What was her response?
No.
Did you see any signs of psychosis present in her that day?
No.
So the plan at that point was just to taper off the Ativan, but nothing was added at that point?
Yes.
So at this point, it's been a little over 2 months of seeing Dr. Tuff, and Lindsay and her husband really don't feel like she's getting any better. So Patrick's mom suggests that Lindsay see a woman by the name of Julie Paul. Julie was a nurse practitioner at South Shore Health Facility, and she was leading a postpartum psychiatric program. So Lindsay goes to see Julie Paul on November 21st. She again gets questioned on thoughts about self-harm and other harm, and she also ends up getting a new prescription.
Yes, I asked her specifically if she felt like she wanted to harm herself or her children, and she said no.
And how about asking her about homicidal ideations?
Yes.
And did she indicate whether she had any?
She did not.
Did you also ask her whether she had experienced any auditory hallucinations?
I did.
And did she experience any?
Not at the time, no.
And did she indicate to you whether she'd ever experienced any?
No.
So for this patient, for Lindsay Clancy, what did she identify as the reason for the visit?
So she said pretty much I cannot sleep was her major concern.
Now, once you were able to kind of gather all this information from her and do these screenings, were you able to come up with an assessment and a plan?
So we had discussed starting Prozac. So I gave her 10 milligrams for the first 4 days to make sure there were no adverse reactions. And then I was going to increase her to 20 milligrams if she tolerated that well.
Okay. And what about some of the medications that she had already, that she was already on, the Ativan and Benadryl and the Trazodone? Did you have a plan for those?
I did. So I encouraged her to take the Ativan just in the beginning, just to help her be more comfortable with the anxiety and to make sure that it didn't interfere with her sleep.
And as far as follow-up with you as the clinician and prescriber, was there a plan set for when she was going to return?
Yes, we had established a return in 2 weeks.
Lindsay was scheduled to return to the South Shore facility for her follow-up in 2 weeks, but with the understanding that Julie Paul was no longer going to be her provider. It turns out Julie Paul was moving, and so Lindsay was reassigned to a woman named Dr. Rebecca Gelada.
Did Dr. Gelada, to your knowledge, put her on medication?
Yeah.
And what was the medication, if you know?
Mainly Seroquel and benzodiazepines, Ativan.
And to your observation, again, you're not a doctor, what you saw of your wife, was she affected positively or negatively by the Seroquel that she was on?
It appeared that she was affected very negatively, and she's reporting that that she was getting worse on the Seroquel.
And do you know, did she report that to Dr. Gelada?
Yeah.
Are you following that? So by this point, and I don't think I included all the clips of all the medications, she's been prescribed Zoloft, Ativan, Benadryl that she got herself, Trazodone, Prozac, Ambien, Remeron, Klonopin, and Seroquel. Now, Lindsay wasn't taking them all at one time, and in fact, she scheduled an appointment with Dr. Tuff to tell her that she was transferring her care over to them and would be going by the prescription recommendations that they gave. But that was only short-lived, because by December 1st, Lindsay was back to seeing Dr. Tuff in her virtual appointments.
And what was discussed at that appointment?
That she wasn't getting better. She had tried the Ativan taper, but without the Ativan, she was having a lot of difficulty sleeping. So she tried a few different medications, a few different medication combinations, but she was having trouble with them.
And these medications that she was talking to you about, those weren't prescribed by you, correct?
Correct.
Did she tell you that those had been prescribed by her provider at South Shore Perinatal Clinic?
Yes.
Did she also tell you that she was having some intrusive thoughts?
Yes.
Did she tell you what those intrusive thoughts were?
She said it was a feeling like I'm going to die.
Not a feeling that she wanted to kill herself, but a feeling like she was going to die.
Yes.
Did you ask her if she had suicidal ideation?
Yes.
What was her response?
So she denied having suicidal ideation, but she was feeling pretty badly. She said she was close to it, meaning close to having some suicidal thoughts, and that she was feeling very hopeless. But she didn't have any active thoughts of hurting herself, didn't have any intention of doing anything, didn't have any plans.
Did she also tell you, and this is a quote in the records on page 144, "I think it's my problem. I keep reaching out to different people and not sticking with the plan."
That's what I documented.
Okay. And did you discuss that with her, that concern that she kept reaching out to different people and wouldn't stick with the plan?
Yes. I advised that she have one person who is managing the medications so that it's very clear what's happening.
Around the same time Lindsay tells Dr. Tuff that she's having intrusive thoughts, she also tells her husband Patrick that she's having these thoughts.
She described thoughts of hurting the kids or them having some sort of ailment.
And did she tell you whether or not she had specific thoughts of how she would harm the kids?
No.
And she didn't describe that as hearing this external voice telling her to harm the kids, correct?
Correct.
She told you she was having intrusive thoughts, herself of harming the children, correct?
Correct.
How many times did she tell you this, that she had thoughts of harming the kids?
A couple times. I think I asked her at some point, do you feel like you need to be kept away from them? And she said no. And then, it was very confusing because a minute later she was making them lunch or playing with them or, getting them ready for bed or whatever it was. So.
Were you concerned for the kids' safety at that time?
No, I wasn't, because she wasn't showing any intention of harming the kids.
And she told you she didn't have a plan, is that correct?
Correct.
Somebody educate me. If people are having certain thoughts, but they say they don't have a plan, does that invalidate the thoughts? Does that mean you should not take those thoughts seriously? 2 weeks after Lindsay admits to having these intrusive thoughts, the thoughts get worse, and Patrick insists that she go to the ER. And that ER visit resulted in her being admitted to a program for postpartum women, but she didn't stay long. After
Being at Mass General on December 15th, did she go to Women and Infants Hospital in Rhode Island to attempt to get into their postpartum program?
She went in as scheduled.
And at some point in time, did Lindsay reach out to you to say she wasn't staying at the program and to come pick her up?
She actually said that the providers at that program suggested to her that she call me and have her come get picked up, and then that I should go in and meet with the providers.
Okay.
Their recommendation was that the program wasn't right for her.
Right. And so you guys returned home, is that correct?